Is it like special?
Hi everyone! I'm so beyond myself excited to be with the Drive for Men's Health docs. Hi everybody, and thank you so much for joining us on the first day of our second annual Making Dad Summit. And once again, these amazing doctors are with us this year. And today we're talking about, this is the topic, Drive for Men's Health are talking about what fertility can tell you about a man's overall health. And I just want to take one moment and say a very well thank you to our summit sponsor. It is with great thanks we acknowledge Fairfax Cryobank for sponsoring Making Dads Telesummit. It's through their generosity that this important conversation is funded. Fairfax Cryobank is one of the world's largest sperm banks, offering anonymous and ID option sperm donors, as well as storage service for sperm, embryo, and oocytes. And you can learn more about them on their website at fairfaxcryobank.com. And welcome, Sarah, and welcome, doctors. I'm going to throw it to Sarah, and she's going to introduce you and talk about your ride and where you're at. And I have my Drive for Men Health wear on today. Woo! Woo! Woo!
I absolutely love these guys. These to introduce these doctors, Dr. Jameen Brahmbhatt and Dr. Sijo Parekattilwelcome, who's they're a couple of doctors out of Florida who are urologists. They specialize in male reproduction and various other, ball pain. Yeah, they're experts in ball pain, as I learned. They do robotic surgery, which is super cool, where they use robots to do very precise surgeries down in that region. And they have, in the last 2 years, been doing this Drive for Men's Health. So this is Men's Health Month, and really finding the importance of this conversation of men's health. They got their brand new Tesla, and they hit the road, and they've been driving from Florida. They just went to New York, and they're on their way now out west towards California, where they're going to end up in LA. And along the way, they're stopping and talking with a whole number of experts and doctors about men's health issues, including fertility, but also including heart health, diabetes health, all kinds of things, and looking at the latest gadgets that men can use to help be on top of their health, and just really talking about what men need to do to stay on top of their game. I love these guys. They're super crazy awesome. They're a little bit nutty. So, guys, why don't you give us an update? Where are you at? What are you doing?
So we're driving to Delaware. Right now, we just left New York City. We had an event at Mount Sinai Hospital yesterday, and today morning, we've been on the road for about 3-4 days. So
5 days. 5 days.
Thursday. We started Thursday. So
Friday, Saturday, Sunday, Monday.
Is that 5 days?
Yes, Monday. Thursday, Friday, Saturday, Sunday, Monday. 5 days.
They're arguing like an old married couple already, and it's only 4 days.
So you can tell the effects of being on the road for a few days together.
Yeah. And a little dehydration and
yeah, we learned a few things. We have an RV, a crew of 11 guys with us. Really great guys. That's true, 13 altogether. And so we have an RV and the Tesla, and so so we learned a lot about RVing together. So we're going to do some things a little bit differently next year. Maybe get a little bit larger bus for the RV and stuff. But we've had a blast. I mean, it's really cool. Like, we've had multiple stops, lots of people coming in at the different stops, a lot of media attention. But
you know what?
we're hoping if.
I love the best when you guys started. You ran the stop sign, and the police were, shot the gun for you to leave, and the videotape showed you running the stop sign, and the police officer goes, "You didn't even stop."
Police escort.
Yeah, we were allowed to do that. We had a police escort.
Okay, because one of the people on the recording said they didn't even stop for that stop sign.
But we're just having a good time. We're driving 6,000 miles. It's day 5 out of 10.
It's really cool. We're headed to Cleveland clinic tomorrow, so we're
Hopefully
we're racing along to get there in time. So tomorrow morning we have an event at Cleveland Clinic, and it's really cool, guys. I mean, and then participating in this event with you guys. I mean, we love this. It's really, really cool.
Well, I'm honored that you're with us again, and I'm just so excited that you are doing this just to bring so much awareness to men's health, and it's been amazing so far in the conversations that we're having, and how it's so important to get out that men need to be seen. Men need to have regular doctor visits. And last year you were so funny when you were talking about how, they have to be bleeding before they go.
They do. If you look at statistics, in 1920 the life expectancy gap was only 1 year, and now it's 5 years. So with all the latest technology, healthcare, medicines, we're just lagging behind more. I mean, we may be living longer, but we're living less than our female counterparts. If you look at the top 10 causes of death, serious thing, that's following us. No, I'm just kidding. We like to have a good time. That's why guys like talking to us about their various medical ailments, because they know we can relate to them. But if you look at the top 10 causes of death in the United States, men are likely to die of 9 out of 10 of them. This is crazy. And this is Men's Health Week, and it's Men's Health Month as well. What we need to do is drive that change every day. We can't just, in one day, try to change the way these guys are taking care of themselves. And throughout the entire journey, I mean, we've had several speakers talk about various infertility issues, and we will continue to talk about it as well, because people just think infertility is just sperm, but there's so much more in the body, if you look at the whole body, that causes that sperm to be the way we want it to be, to have that ideal movement and pattern and interaction with the egg when it's time to interact.
So if you circle back to the topic that we're so excited for you to be sharing, how does one's overall health affect it, or the other way around?
Well, there's a lot of things that can affect your infertility. Well, first and foremost, you have to be healthy. So think about everything before the sperm gets out. You have to think about your overall body. You have to have you're healthy, your heart is healthy, your lungs are healthy, that you're going to have a better sex life, which then will lead to more encounters sexually, to you be able to have that process where the sperm goes and you get the pattern of reproduction and sexual activity, and et cetera, et cetera, et cetera. So you have to be healthy. But if you're like 30 years old and morbidly obese, and even walking up a flight of stairs is difficult, then having sex is going to be very difficult too. So you're going to have infertility issues that way. Speaking of obesity as well, when you have obesity, you're likely to have higher levels of estrogen, which can affect your fertility as well. But just overall health, your sperm have your genetics in them. So if you overall are in an unhealthy state of mind, then your sperm are also going to be in an unhealthy state of mind.
Right, that makes sense. If it's just common sense that if you're healthy, then your insides will be healthy also, right? And so, what do you think it is that keeps men from, having that mindset or desire or need to go? Like women, from the time that you're an adolescent, then you go to an OBGYN, and then you have your annual mammogram. So what is it, the whole systemic problem for men, that there's not like a process for them?
Well, I think it's just lack of awareness. Women, I feel, have more opportunities when they're younger to be engaging healthcare professionals. And you mentioned it, when they're of childbearing age, they're going to go see their doctor, and then when they go see them for that, they're going to get the other screenings done. Men really don't have a reason every year to go see a doctor. But if you look at the guidelines, doesn't matter how old you are, 20, 30, 50, 60, 70, you should be going and seeing a healthcare professional at least once a year. And based on those guidelines, there are certain things that you should be getting done. At a minimum, you should be going to see your physician. You should be getting your blood pressure checked. and then based on your various risk factors, getting some basic lab work done as well. As you get older, that lab work and then the amount of things they examine in the office is going to get larger. That's because you're more prone to having other diseases down the road. But at the same time, you can't just go by a guideline. If you have certain risk factors, let's say for prostate cancer, then we would want you to get screened earlier for prostate cancer because you do have that family risk, which does elevate your risk of having bad prostate cancer down the road. So, you know, it's not just, it's a very dynamic process. You can't just go by what you see in a graph or what's in a guideline. What you need done is more of a conversation with you and your physician or your healthcare provider. Now, the reason I keep it so vague is now it's not just doctors. You know, we have extenders, nurse practitioners, PAs. There's so many opportunities to get in with a primary care healthcare professional. You know, we had a guy yesterday complain that, well, I have to wait 4 months to go see my doctor. Well, you know, you probably do have the option of going to a take care clinic in one of the pharmacies. You can always call the doctor's office, talk to a nurse, see if he can get you in sooner, see if there's a nurse practitioner or PA that can see you. I think from a primary care standpoint, all of those specialists are qualified to be doing the basic screening that is needed. So I don't think it's an access issue anymore. I think it's more of a motivation issue on the standpoint of that patient.
All right. So how do you see to motivate men to take that action? I mean, I know.
Cars.
Yeah.
Cars. Last one.
Hey, is that the same car I drove in Florida?
Yes.
Oh,
Yes. Is amazing.
that is crazy, amazing.
So we actually through Orlando Health, we did a survey right before this drive, and we surveyed 1,000 men. I'm going to ask you guys this question. These were the two easy questions they asked. Number one, what was the make and model of your first car? Sara?
Ooh, crap. It's a Dodge Spirit, I think.
Okay, what about you, Kristen?
1964 Buick Riviera, loaded race car.
Whoa!
Wow.
That's an amazing.
So we asked 1,000 guys that question. Over 80% of the men knew the answer to that question. Now, the next question was, when was your last doctor's appointment? Do you guys remember your doctor? And today, meeting us doesn't count.
You mean like if I was sick or my annual or?
Anything.
No, April 13th.
Okay.
What about you, Sara?
A lot of guys.
Mine was like 2 weeks ago.
Wow, that's awesome. So see, this is why when we ask men these questions, they don't remember. And in the survey, about half the men remembered. So there's a big difference. You know, guys remember. Like I remember the exact day I got my Apple Watch, and I was waiting for it. I remember, you know, the first time I drove Joe's Tesla. And I remember, you know, when I got my curved LED TV. You know, I'm like, I remember those things. I look forward to those things, but I don't look forward to, you know, even though I'm young and fairly healthy, I look forward to going to see the doctor, even though the doctor's half the time right next to me, right here. So, I think it's a mindset issue where, you know, we get more excited about things that give us immediate reward rather than things that can give us prolonged rewards down the road.
So I totally agree, and I do think in talking with guys that fatherhood is one of those things that can be a wake-up call. And you know, when you finally drag yourself into the office and you get that semen analysis done and you find out that something's not quite right, I feel like that is a really good opportunity to explore what's going on with the body. So what would you recommend for those guys who get that first result and see, oh, something's a little bit off? What should they do next? Love the shades.
Well, it's so bright. I'm sorry, the laptop's. Wait, what do you mean? Like, what was that question again? Sorry,
So,
He put on his cool shades.
no, I was having like a headache.
yeah, you're too cool for medical talk now.
No. The sun was hitting my silver back, and then it was hitting my eyes. So,
Oh my gosh.
Sorry about that, ladies. So, sorry, what was that?
No worries. The question was, so if you go in and you're on this journey of trying to conceive,
Okay, here.
and you finally go in to get your semen analysis, and you find out that something's, oh, that's awesome, those are mine.
Oh my God, you guys! Stay on topic. Stay on topic. Come on.
White for fertility. Why, the other doctors aren't as serious?
Oh no.
Okay, you want us to be like the other doctors?
No.
No.
Talk about the
The biochemical pathway of driving a Tesla. So you have to press the engine. You have to turn the wheels. Then, do you have any other questions? Does the audience have any questions?
They do, actually.
All right.
So
semen analysis. So what the heck is a semen analysis? Well, semen analysis is when a guy has to essentially give us his ejaculate to check and see his fertility potential. Now, one of the common problems that I see is that guys don't really follow the rules when it comes to what not to do before they give us semen analysis. So that's why we always recommend that you have it checked twice. So we tell them,
that's a tweet. We got to get that, Shannon. We have to tweet that because that's the
doctor tells. Yeah, if the doctor tells you don't ejaculate 2 days before, don't, because I have guys that ejaculate the night before and then they come and give me a semen analysis in the morning. Well, duh. Odds are it's going to be a little low, so what we usually recommend is 2 days. Now, I know this is very hard for most men out there to wait 2 days, but it's necessary. But that's one thing is we always repeat it first. Now, when we do get that semen analysis, well, there's many different things that we looked at. We look at the total count, which is how many total sperm are in there. We've seen guys all the way to have just one sperm. And then after doing all the things that we can do, they have millions. But then there's some guys that has one sperm, and then we can, it's hard to help them, but there's definitely things that we can do. But the big things that we look at are really just 4 things. I know when we get the analysis, there's a million things in there, but we look at the count, the concentration, so per cc, how much is in there. We look at the volume of the ejaculate as well, and we'll kind of go into some of this later. And then we look at the motility, how free-floating are they? That's the 4 biggest things that I start off with. And then obviously if things aren't going the right way, then we'll look at some of the other research-based, detailed things. But that's the 4 things that I usually look at most. Anything else that you look at? Semen analysis? Or? No, that's it.
You know what? So you're so awesome. That's why you're in the Tesla driving around, because no one has talked about the waiting period before the ejaculation.
Yep, you should wait at least 2 days. Now, I don't know if all clinics practice that, but that's our standard is 2 days, so that we can get a really good sampling of what's in there. The other thing is, if you're on testosterone or taking some kind of weird supplements in the gym, tell your doctor. Because I usually, I have certain patients that don't admit to it until their wife leaves the room, or they'll send me an email later, well, Doc, I didn't want to tell you this, but, me and my boy are, trying to get fit, and we're taking this injection. I don't know what it is. So be honest with your doctor. If you're taking anabolic steroids or taking some weird supplement from somewhere, then just tell us, because then we can look at this a different way. If your sperm counts come to 0, and you don't tell us you're taking testosterone, then we're going to go down a very intense path to find sperm, when it could just be as simple, we'll just get off with this stuff, let's give you something to boost things in there, and then let's see what happens in 6 months. You may not need any surgery. So you have to be honest. The third thing that's a duh is, and I'm sorry, I know this may not be a topic, is, are you guys even having sex? We have certain patients that come in, and they have infertility, and, we get into question like, oh, they're like, yeah, we're doing it all the time, blah, 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 we're timing things, and I ask specifically, this week, how many times did you guys have intercourse? And unfortunately, a lot of times, like, well, not this week, we're really busy. I'm like, okay, fine, the past 2 weeks. Maybe once. Okay, what about the past month? How many times did you guys really have intercourse? They may be like, oh, 3 times. I'm like, what? 3 times? I mean, this, if you guys are trying to get, for lack of a better phrase, bang for your buck, you should be engaging in intercourse. I know we can try to plan things around your cycles, but I usually tell them every other day. Try to do it every other day. And most guys are like, yeah. But, the more you do it is better, because there's certain treatments such as IUI, which is in utero insemination, where they basically take your sperm, concentrate, and then drop it past the cervix into the uterus. Well, that's basically like having sex, to be very honest with you. And so if you're going to spend a couple $100 doing that, there are certain people that do need that. If they have certain issues with their cervix, if they have certain issues with intercourse, then that's what you need. But why don't you, before you sign up for something like that, just have regular intercourse? You're trying to have a baby with this person. Why don't you just try to do as naturally as possible? So those are the three things that when I come into my office, when they come into our office, both our office, we try to ask them, because those are simple things that we can change and help out in a matter of seconds if we do that information accurately.
That's awesome. That's okay. We can be done. But you know what? Now I was so distracted because when I was looking at your sunglasses, I could see the road in your feet.
Oh yeah.
Sorry.
He has great socks. Always has great socks, by the way.
Yeah. No, it's because you can see it in your. So all the time you were talking, I'm like, oh my God, look at the road. Sorry.
Now he's warming up for the real Dr. Brahmbhatt.
It's the glasses. I needed the glasses.
I think it was the glass switch. I think that was what it was. He wasn't feeling his feng shui.
So, oh, sorry. What was your next question?
No, I wanted to know, if you get your semen analysis back, you've talked about these simple things, but you have a low result. What are some of the health issues that are related to poor fertility that, this is an opportunity to really deal with your health?
If you think about, let's say, the simple stuff, let's look at anatomically and health. So if you've had a vasectomy, obviously you're not going to have a good semen analysis. But if you had trauma to your testicles, so back in the day, if you had someone kick you in the testicles, or if you were just born with something genetic, or genetic abnormality where your tubes just don't connect, but then seals. And I really, when we have people come and see us, shadow us, or we have fellows, we really try to stress the physical examination. And we become so dependent on just lab work and imaging that we forget the power of the examination. And we, I think since we've been together, have diagnosed things like testicular tumors in patients that come in with infertility. We've diagnosed really big hunky varicoceles that can affect infertility. We've diagnosed big hernias that are kind of compromising the blood flow to the testicle. So we've seen it all.
So that just from a physical exam without a test, you can see that if they go to you, if they go to the right doctor.
Actually, we have some really awesome news today. We had a gentleman. You want to tell her that the semen analysis?
Oh yeah.
This is really cool.
So we had a guy who basically, one of the things that we specialize in is robotic assisted microsurgery. And what robotics allows us to do is to do things that you can't, to kind of take microsurgery to locations in the body that usually would be very difficult with a microscope. And so this was a young gentleman who had a bilateral hernia repair. He'd had a child before, and then had a bilateral hernia repair, and then after the hernia repairs, unfortunately, his sperm count went to 0. And so what had happened, unfortunately, is during the hernia repairs, his vas deferens, that's the reproductive tube that comes from the testicles all the way to the prostate, got damaged on both sides. Now, classically, this is a very difficult, condition to fix because you have to go in the groin, do big exploratory surgery to find out where the damage occurred. There's usually a lot of scarring because with hernia repairs we tend to put mesh in the area. And technically it becomes very difficult because then you have to bring the microscope in and try to do the reanastomosis or reconnection of the vas. And the success rates usually from publications are in the 5 to 10% success rate. Now what we've done so far is using robotics, we can actually bypass the whole groin area, kind of make a small incision in the groin, take the vas up to close to where the hernia is done, and then bury it in the abdomen. And then we go in with the robot through the belly button on the inside of the abdomen, and then swing the vas, the tube from the inside, above where the mesh was done, swing it more medially, and then reconnect it inside the abdomen. So we've done the first 4 cases in the world, and our 4th guy, so far we've succeeded in all these cases. And our last guy has got his seed analysis results, and he's got phenomenal numbers. And so when you see, technology and some of these treatments being put to very unique uses to allow guys to have a child, I mean, that is priceless. So that we just got his results yesterday.
It's huge, and that's the awesomeness of technology. Is a lot of the stuff we do. We don't. You mentioned robotic surgery, blah blah. We have really good data. Our data is very similar to people that don't use the robot. The robot is just a tool that we use to do our procedures. But with the robot, especially in cases like this, we're able to get these guys that would have really no help, get them to have natural pregnancies, and this is what's extremely powerful in getting us. It allows us to go places we thought we could never go before.
So are you saying after this amazing surgery, they didn't need any assistant reproductive technology?
Well, it has. It's still fresh.
They haven't achieved the pregnancy.
Oh, okay. Oh, I thought you said. Oh, I was like, oh my gosh, you have to write a paper on that for sure.
There's a good chance that they will get pregnant. So this is huge, because otherwise the only choice for these guys would be.
If you think about it, like every fertility specialist, our main goal is to get that sperm out and maximize it, make sure it's the most powerful sperm out there. Then what happens is there's a lot of different factors. We work very closely with the IVF specialists, the doctors that refer patients to us. We always work very closely with the female counterpart as well to try to maximize the efficacy. But our main goal is to ensure that we have the sperm coming out at the time.
Well, what is so powerful about what you're just saying is that for that man who had the diagnosis or received that information that there was no sperm, it doesn't mean that there's no hope. That there is hope through this amazing, your abilities and technology and your knowledge. There's hope, and that's was the drive and the inception of this conversation for you to share that too, Well,
there's definitely hope, and that's what I tell my there's when both of us actually, because this guy was my mentor, when we have a patient come into our office, during our discussion, we tell them, if your goal is to have a baby in 9 months, like this year, then the fastest way is going to be likely assisted reproduction, because they can get the female primed up, we can help extract your sperm, and then let's go. But if you want to be patient with us, and if you want to try for a natural pregnancy, then work with us. It's going to take some time. It may take days, it may take months, but let us do the evaluation. And most people understand that, and they respect that. A lot of times and I think this is one of the other reasons we get to a more global problem is, and why men don't go see a doctor is because, mentally, they may be brainwashed and think, oh, doctors just want to do procedures, or doctors just want to put you on pills, or doctors just want to check your prostate, but that's not the case. As physicians and healthcare providers, our main goal is what your main goal is, and in terms of infertility, that's to have a baby. And whatever you want us to do, however way you want it, my goal is to provide you the knowledge, give you the options, and then we're basically in the co-pilot seat. And you are the pilot. You're driving the ship. You're driving the Tesla, and you tell us where you want to go, what your destination is, and how quickly you want to reach that destination.
That's the goal, right? To listen and have a trust for the doctor that you're going to be working with, and that goes to the question I sent you from one of the clients.
What was that question?
Ready? So the question was, and it's so perfect for what you were just saying, because he was born with an undescended testicle, and he was told he was infertile.
Sorry, hold on. We're having a little Wi-Fi issue. Wi-Fi issue. Okay, Wi-Fi issue.
Oh,
Wi-Fi issue.
there we go.
Wi-Fi issue. Okay. All right. Go ahead. Sorry.
Go ahead, Sarah.
Oh, so we had one of our participants write in and he was born with one testicle. I think he was just born with one. We don't know if he had another one that's not descended or not.
No, it was he has one, but one was not descended, and he was told his parents told him he could never have children.
No, that's not the case. I mean, there's thousands of men out there just with one testicle, either because of history of trauma to the testicle, either with a history of cancer to the testicle, or things like bad infections, like bad orchitis that led to that testicle not functioning properly. I mean, I would not assume that. I mean, the only way to know what your fertility potential is, well, there's several ways. One is get your semen analysis. If it's negative, check it twice. If it's negative, then check some hormone levels. Maybe there's some central thing going on.
So the other thing that's important with guys with a single testicle is that it's very important that we know what happened to the other testicle, because if it didn't descend, usually for some of these men, we need to get an MRI of their abdomen to make sure that they don't have a testicular remnant inside their abdomen, because that testicular remnant has a high propensity for forming cancer. And so in patients who come and show up with a single solitary testicle like this, one of the key things we have to make sure is that he's been worked up before, and that somebody's at least looked to try and make sure he doesn't have a remnant, because if he does have something in his abdomen, a small testicular remnant, that needs to be removed.
And the thing is, even if he doesn't have sperm and his labs are all okay, then we can go and investigate inside the testicle to see if he has sperm. So we can do biopsy of the testicle, we can do mapping of the testicle. So it's not an end-all, be-all. Like, we can even go even more intense and do a microtesy, where we basically investigate all the small little tubules in there. So we will do everything we can to see if you have sperm. We'll do genetic testing. And unfortunately, there's certain times where you won't be able to. But now with technology, you can find a donor sperm that looks pretty much like you, or has certain characteristics that you want. So it's not the end of the world. And there's also adoption. Your goal is not to have a kid, but your goal is to be a father. Your goal is to be a mother. And whether it's a child that you had naturally, or you adopted, or had some assistance with, you're still going to get that end goal, which is a father.
Right, and that's my area when we talk about the emotional component, and there is a cycle to that. And I think to get to that point, to be comfortable with being a parent, if the baby comes through you or to you, there's that emotional component. And for me, when I finally came to the point that, right where you were talking about, the goal was to be a mom, the goal was to be a parent. I had to do everything that I had to do before, all the options came into place. And I think what you rattled off before is that there's things that open up hope and that can be done through medical intervention, and you don't have to stop dreaming that dream yet. There's a whole bunch of options. Sarah, did I lose you?
Stigma that, oh my God,
no, I'm just tweeting away.
Oh, you're tweeting. I was wondering what you're doing.
Oh yeah, no, there's so much here to talk about, so I'm making sure it's on.
You're being tweeted.
The thing is, what we want is couples to know that, you got to think global picture. And I have couples that get stressed out, and what will people think if I adopt? Who cares? That's your child, and you're gonna live your life with them, and you're gonna go take them to Disney World and take them to school, and get them married off. Like, who cares what Uncle Bobby thinks today? It's you are giving someone, a child, an opportunity through adoption to have a parent, and that child is giving you the opportunity to be a father or a mother, and nothing can take that away. Other than
Sarah's typing. Can you hear it?
I am.
Sarah's tweeting you.
All your other doctors don't give you nice quotes like this? Just kidding.
No, I don't think so. So why don't you talk a little bit about
This is what a few days in a row before she does.
I think.
So why don't you
Yeah,
talk?
I want everyone. you're in the New York area to watch CBS at 5:40, we're going to be on talking about our drive. So tune in.
5:40.
What was the CBS in New York City or on where? What channel?
CBS New York, Channel 2.
Channel 2, 5 p.m. We're
Channel
gonna watch
2,
it.
CBS. It's local New York, so we'll put it up on our website once it goes up.
All right. So why don't you tell us a little bit about the clinic, your clinic, and then we're gonna let you focus on driving. Did we lose you? Sarah,
I'm right here.
did we lose the docs?
I don't know. They're there. I see them, but they're kind of paused.
Well, why don't we give them a commercial for their clinic? It's called the Per Clinic.
And they specialize in, as we've talked about, robotic surgery. They treat male infertility, testicular pain, other issues of the male reproductive system. They're an incredible team. They presented just recently. I was down with them in New Orleans, and they were presenting at the American Urology Association annual conference, and they do incredible work. And so just really a big shout out to these guys. You know, they're a lot of fun, but they're also really damn smart and really damn good at what they do.
They are. Wow. Are you there? Did we lose you?
Thank you, Sarah. Thanks, Sarah. Sarah, did you hear that your logo is the most popular logo on our car?
I love that. It's appropriately placed near the rear end. I love that too.
Everybody asks us, what is this logo? What does it mean?
We say, don't cook your balls.
Hey, Dr. B, can you get a picture of all 4 of us? Can you do that? How can we take a picture of all 4 of us? Oh, get.
You have to do Command Shift 3.
No, it's 4. Go ahead, go back on, get everybody, and I'm going to take a picture of us.
I took the picture. Did you take it?
Yeah, I got it. All right, so one last thing before we let you go. All your information's on the landing page of the summit.
Yep, ParekattilWelcome. We're infertility experts, but really our focus should be on the Drive for Men's Health. Please follow us, driveformenshealth.com, or tweet, Facebook, Instagram, and we're doing a lot of periscoping. So if you want to live broadcast with us via Periscope, ask questions. You know, we've been doing this drive. We're driving 6,000 miles, and I would say my mission is complete because having fun on Periscope. And we had a lady that's just started following us on Periscope, found us, was listening, and then she messaged us yesterday saying, guess what, guys? I got my husband to go make a doctor's appointment. Thank you.
Oh,
that was just us talking and interacting with people on Periscope. So, I mean, it's just saving one life or helping one guy makes this entire journey worth it.
And we really appreciate you guys always including us, and you know, it means a lot to us. And you know, it's just an important topic, and you know, I think we're all trying to explore ways to make this more fun and less, you know, make men less fearful of discussing these kind of issues, and you know, make it more fun.
Well, you do that, and you're so amazing, and you bring such a different energy to the awareness of this. So thank you. And well, you know what? You need to save us a couple T-shirts to put in the goodie bag.
Absolutely.
Absolutely.
We got too many of them. Yes.
Okay. And
are you guys gonna come out in LA to meet us?
Sarah's in LA. I'm in Mass. I'm in Massachusetts. So Sarah, you going?
I'm in San Francisco.
Are you too cool for us now?
Say what?
Are you too cool for us now?
She's too cool.
Not me.
Sarah, you got to come out and meet us in LA.
Are you guys? Where is you're driving through?
USC. We're gonna be at USC.
Vegas or what?
Oh my God! Not
this
unofficially.
Year, but
unofficially, we may be.
Next year.
Are you driving 80? What's the route that you're gonna get to?
We're going through Phoenix, Arizona, and then we're gonna go through what's that? What's that? It's one town. We kind of go from Phoenix, Arizona and then we go up north to LA.
Okay, so you're dropping south before.
Yeah, we dropped south before, unfortunately. Where are you based out of?
I'm in the San Francisco Bay Area, so I'm north.
Maybe next year.
Yeah, we'll see. We'll see. It's on. What day are you getting in LA?
Saturday.
Saturday. It'll be Saturday afternoon from 1:30 to 4 at the Keck School of Medicine, USC.
Okay.
So,
we're going to get that out and tweet that so everybody in that area can come see you.
If I'm feeling ballsy, I might pack up my kids and drive down there.
What? We'll see you there.
Are your families with you? Are your families with you?
We usually have a crew with us. I mean, we have an RV following us, but they all wanted to eat, so no one wants to sit with us on this leg. But we have like our families aren't with us, but they will meet us at different stops.
They're going to meet us in LA and stuff, and so we have a really cool name for our RV. We call the RV the All Set. It's Tesla backwards. The All Set.
That's awesome.
The Tesla.
I love all the Facebook pictures with you and your crew, and the nights when you're talking, and it's really been a lot of fun to follow you guys on Facebook, and I hope you get all my encouraging messages. I've been commenting.
No, we love them. We love them. Thank you so much.
I didn't know we were both Michigan alumni. That's an awesome connection we have.
Go blue. Go blue.
Hell yeah. We'll have to do a.
We love you, and we're so proud of you guys, and you're doing such a great job bringing awareness to
men's health. As well are doing an amazing thing, providing this education to people out there, and a lot of it is demystifying myths, and that's what we're trying to do with men's health. That's what you guys are trying to do with infertility, and we're doing it together. We're partners in crime, and that's
the best part of it. It really pumps us.
This is the idea for next year. You guys do the Google Hangouts, and Sarah and I will drive the car.
Sure, no problem.
Sure. No problem.
We have drivers. Yeah, we're looking for drivers, especially night drivers.
Okay, well, next year it's us, Sarah and I, in the car, and you guys run the whole summit. How's that?
Sounds like a plan.
I'll get my sunglasses.
Oh, yeah. All right. Drive for Men's Health. We love you. You're doing amazing work. God,
we love you. We love you guys. And you can see Jamin's mood just improved just by talking to you guys. I mean, it's awesome.
He won't stop for coffee. That's the problem. Because then I have to pee. That's the real problem.
Hey, don't you know a doctor that could help you and give you something so you wouldn't have to stop?
No, but he won't stop for coffee. He's like, we gotta go.
Yeah, I wouldn't let him bring a urinal into the car,
No?
Gatorade bottles. All right. Now we're getting a little risque here. Please edit that out. But ladies, thank you guys so much for allowing us to be a part of this awesome summit. And if there's anything else we can do for you or any of the other patients out there, definitely let us know.
Well, we will send your way, and everybody that they can live tweet you questions and get a hold of you on your website, and in real time they have access to you about any questions that they have.
Awesome.
And anybody in Cleveland, Detroit, or Chicago, the next couple days are going to be, that's where you guys are going to be, right? You're going to be in Cleveland today, and then Detroit later, and then the next day you're going to be in Chicago, right?
Yeah, Cleveland Clinic will be tomorrow morning from 8 to 9 a.m. at the Cleveland Clinic. And then Detroit is...
Detroit, like 2:30.
Yeah, Detroit will be...
It's all on our website.
Yeah.
And then we go to Indianapolis, and then Chicago.
Chicago, man. Okay.
And Minneapolis, and then Phoenix.
We'll be watching.
Well, I have family in Detroit, so I'm trying to send all my brothers out to check you guys out. You gotta give them the VIP treatment with the car.
No problem.
Absolutely.
All right.
Okay, be safe. We love you. Be safe.
Thank you. Bye-bye.
Bye.